Friday, March the 12th. Since Wednesday, we've lost an additional 9 people, it looks like. 8 people, I'm sorry. And then we've surely got the situation to where I reported to you that we had 168 deaths that were not properly reported to DHHR, and 84% of these deaths occurred in the months of December and January. We'd had plenty of time for whether they came from nursing homes or hospitals or wherever it may be, to report these wonderful people, and it just was failed. It failed in happening, and in trying to be 100% transparent like we always are. There's surely days that I've got to come out and report to you things that are not very pleasant. But this situation is totally unacceptable to me in every way. They've just updated. We've had 16 total deaths since last Wednesday. And so just bear with me, because we owe these people all this respect, and I'm honored to be able to read through all these deaths and everything, because we owe them that, do we not? But our 131st death is a 79-year-old male from Clay County. Our 23rd death is an 86-year-old female from Kanawha County. Our 23rd death, a 74-year-old male from Lincoln County. Our 2334th death, a 91-year-old female from Wood County. Our 2335th death, a 79-year-old male from Hampshire County. Our 2336th death, a 75-year-old male from Mason County. Our 2337th death, a 73-year-old male from Lincoln County. Our 2338th death, an 85-year-old male from Logan County. Our 2339th death, a 90-year-old female from Ohio County. Our 2340th death, a 75-year-old male from Ohio County. Our 2341st death, an 86-year-old male from Harrison County. And our 2342nd death, an 82-year-old male from Wetzel County. Now, I would like to report this, that as we have pushed everybody and really scrubbed the numbers, we originally reported to you that we had 168 deaths that were unreported, and we have scrubbed those numbers, and now we've revised that down to 165 that were unreported. And Dr. Amjad will be back to you later on and talk to you about all this. But our 2343rd death is a 75-year-old male from Kanawha County. Our 2344th death, a 71-year-old male from Mingo County. Our 2345th death, an 88-year-old male from Berkeley County. Our 2346th death, an 85-year-old male from Putnam County. Our 2347th death, a 55-year-old male from Putnam County. Our 2348th death, an 86-year-old male from Greenbrier County. Our 2349th death, a 78-year-old female from Jackson County. Our 2350th death, a 72-year-old female from Raleigh County. Our 2351st death, a 79-year-old male from Mercer County. Our 2352nd death, an 81-year-old male from Marion County. Our 2353rd death, a 78-year-old male from Tyler County. Our 2354th death, a 61-year-old male from Putnam County. Our 2355th death, a 91-year-old female from Putnam County. Our 2356th death, a 94-year-old female from Mercer County. Our 2357th death, a 92-year-old female from Wetzel County. Our 2358th death, an 85-year-old female from Wood County. Our 2359th death, a 67-year-old male from Jefferson County. Our 2,360th death, an 81-year-old male from Wood County. Our 2,361st death, an 85-year-old female from Cabell County. Our 2,362nd death is a 70-year-old male from Wood County. Our 2,363rd death, a 92-year-old female from Greenbrier County. Our 2,364th death, a 72-year-old male from Hancock County. Our 2,365th death, a 67-year-old female from Tyler County. Our 2,366th death, an 82-year-old male from Barber County. Our 2,367th death, a 61-year-old female from Kanawha County. Our 2,368th death, an 85-year-old female from Ritchie County. Our 2,369th death, a 78-year-old female from Monongalia County. Our 2,370th death, a 75-year-old male from Marion County. Our 2,371st death, a 54-year-old male from Kanawha County. Our 2,372nd death, a 93-year-old female from Kanawha County. Our 2,373rd death, an 83-year-old male from Jackson County. Our 2,374th death is a 92-year-old male from Jefferson County. Our 2,375th death, an 89-year-old male from Cabell County. Our 2,376th death is a 73-year-old male from Wayne County. Our 2,377th death is an 85-year-old female from Wood County. Our 2,378th death is a 93-year-old male from Ritchie County. Our 2,379th death is a 66-year-old male from Logan County. Our 2,380th death is a 74-year-old male from Tyler County. Our 2,381st death is an 87-year-old male from Cabell County. Our 2,382nd death is an 82-year-old female from Greenbrier County. Our 2,383rd death is a 92-year-old female from Pendleton County. Our 2,384th death is an 87-year-old male from Preston County. Our 2,385th death is an 85-year-old male from Jefferson County. Our 2,386th death is a 59-year-old male from Marion County. Our 2,387th death is a 50-year-old male from Greenbrier County. Our 2,388th death is a 98-year-old male from Hancock County. Our 2,389th death is a 71-year-old female from Wood County. Our 2,390th death is a 90-year-old male from Wood County. Our 2,391st death is a 76-year-old male from Raleigh County. Our 2,392nd death is a 93-year-old male from Harrison County. Our 2,393rd death is a 93-year-old female from Hancock County. Our 2,394th death is an 88-year-old male from Jefferson County. Our 2,395th death is a 75-year-old male from Brooke County. Our 2,396th death is a 92-year-old female from Hancock County. Our 2,397th death is a 78-year-old male from Berkeley County. Our 2,398th death is a 90-year-old female from Ohio County. Our 2,399th death is an 83-year-old male from Lincoln County. Our 2,400th death in West Virginia is a 97-year-old male from Putnam County. Our 2,401st death is an 83-year-old female from Preston County. Our 2,402nd death is a 70-year-old male from Fayette County. Our 2,403rd death is a 66-year-old male from Brooke County. Our 2,404th death is an 80-year-old female from Mineral County. Our 2,405th death is a 93-year-old male from Kanawha County. Our 2,406th death is an 85-year-old female from Monongalia County. Our 2,407th death is a 69-year-old male from Marion County. Our 2,408th death is an 86-year-old female from Marshall County. Our 2,409th death is a 92-year-old female from Monongalia County. Our 2,410th death is a 75-year-old female from Kanawha County. Our 2,411th death is a 72-year-old female from Wood County. Our 2,412th death is a 75-year-old female from Raleigh County. Our 2,413th death is a 69-year-old male from Pleasants County. Our 2,414th death is an 81-year-old female from Mercer County. Our 2,415th death is an 82-year-old male from Tyler County. Our 2,416th death is a 70-year-old male from Harrison County. Our 2,417th death is a 50-year-old female from Kanawha County. Our 2,418th death is an 81-year-old male from Wood County. Our 2,419th death is an 88-year-old male from Clay County. Our 2,420th death is a 92-year-old male from Greenbrier County. Our 2,421st death is a 73-year-old male from McDowell County. Our 2,424th death is Our 2,424th death is a 102-year-old male from Wood County. God bless this great man and all these people, but 102 years old is really something. Our 2,425th death is a 96-year-old female from Mercer County. Our 2,426th death is a 79-year-old male from Harrison County. Our 2,427th death is an 82-year-old female from Greenbrier County. Our 2,428th death is a 92-year-old female from Cabell County. Our 2,429th death is a 64-year-old female from Lincoln County. Our 2,430th death is an 85-year-old male from Jackson County. Our 2,431st death is a 71-year-old female from Wood County. Our 2,432nd death is an 87-year-old male from Hardy County. Our 2,433rd death is a 74-year-old female from Cabell County. Our 2,434th death is an 82-year-old male from Monongahela County. Our 2,435th death is a 72-year-old male from Lincoln County. Our 2,436th death is a 92-year-old female from Wood County. Our 2,437th death is a 74-year-old male from Monongahela County. Our 2,438th death is a 91-year-old female from Wood County. Our 2,439th death is an 89-year-old male from Wood County. Our 2,440th death is a 79-year. Our 2,442nd death is an 81-year-old male from Boone County. Our 2,443rd death is a 61-year-old male from Roane County. Our 2,444th death is a 74-year-old female from Marion County. Our 2,445th death is a 92-year-old female from Kanawha County. Our 2,446th death is a 53-year-old male from Pendleton County. Our 2,447th death is a 42-year-old male from Berkeley County. Way too young. Our 2,448th death is a 92-year-old female from Monongahela County. Our 2,449th death is a 79-year-old female from Mercer County. Our 2,450th death is a 76-year-old male from Putnam County. Our 2,451st death is an 80-year-old male from Raleigh County. Our 2,452nd death is a 78-year-old male from Randolph County. Our 2,453rd death is an 86-year-old female from Cabell. 255th death is an 82-year-old female from Ohio County. Our 2,456th death is a 78-year-old female from Wood County. Our 2,457th death is a 70-year-old male from Ohio County. Our 2,458th death is an 83-year-old male from Kanawha County. Our 2,459th death is a 72-year-old male from Kanawha County. Our 2,460th death is a 78-year-old female from Kanawha County. Our 2,461st death is a 90-year-old female from Kanawha County. Our 2,462nd death is a 75-year-old male from Marshall County. Our 2,463rd death is an 84-year-old male from Mineral County. Our 2,464th death is a 75-year-old female from Mingo County. Our 2,465th death is an 82-year-old male from Kanawha County. Our 2,466th death is a 90-year-old female from Kanawha County. Our 2,467th death is a 68-year-old male from Fayette County. Our 2,468th death is a 73-year-old male from Raleigh County. Our 2,469th death is a 71-year-old male from Fayette County. Our 2,470th death is a 99-year-old female from Jackson County. Our 2,471st death is a 66-year-old female from Kanawha County. Our 2,472nd death is a 74-year-old male from Kanawha County. I'm going to skip right back here. Our 2,471st death is a 66-year-old female from Kanawha County. Our 2,472nd death is a 74-year-old male from Kanawha County. Our 2,473rd death is an 89-year-old male from Wood County. Our 2,474th death is a 26-year-old female from Putnam County. Gracious. 26 years old. It's really, really sad. Our 2,475th death is a 92-year-old female from Marshall County. Our 2,476th death is a 76-year-old female from Ohio County. Our 2,477th death is an 84-year-old male from Marshall County. Our 2,478th death is a 91-year-old male from Wood County. Our 2,479th death is an 89-year-old female from Greenbrier County. Our 2,480th death is an 85-year-old male from Harrison County. Our 2,481st death is a 61-year-old male from Brooke County. Our 2,482nd death is a 74-year-old female from Kanawha County. Our 2,483rd death is an 89-year-old male from Monongahela County. Our 2,484th death is a 90-year-old male from Mason County. Our 2,485th death is a 91-year-old female from Brooke County. Our 2,486th death is an 81-year-old female from Monongahela County. Our 2,487th death is an 87-year-old male from Tyler County. Our 2,488th death is a 66-year-old male from Kanawha County. Our 2,489th death is an 87-year-old male from, an 87-year-old female from Putnam County. Our 2,490th death is an 87-year-old female from Kanawha County. Our 2,491st death is a 77-year-old male from Wood County. Our 2,492nd death is a 70-year-old female from Wyoming County. Our 2,493rd death is an 89-year-old female from Wood County. Our 2,494th death is an 81-year-old female from Webster County. Our 2,495th death is a 47-year-old female from Hardy County. Our 2,496th death is an 88-year-old female from Wood County. Our 2,497th death is an 81-year-old female from Grant County. The 2,498th death is an 85-year-old male from Wyoming County. Our 2,499th death is an 82-year-old female from Greenbrier County. Our 2,500th death in West Virginia is a 74-year-old female from Hancock County. Our 2,501st death is an 80-year-old female from Marshall County. Our 2,502nd death is a 73-year-old female from Wood County. Our 2,503rd death is a 58-year-old male from Kanawha County. There were 8 additional deaths today, and those 8 additional deaths with the 8 that I read earlier from Thursday, total the 16 that we've lost since last Wednesday. Our 2,504th death is a 76-year-old male from Kanawha County. Our 2,505th death is a 98-year-old female from Randolph County. Our 2,506th death is a 70-year-old male from Monongahela County. Our 2,507th death is a 56-year-old female from Brooke County. Our 2,508th death is a 74-year-old female from McDowell County. Our 2,509th death is a 78-year-old female from Morgan County. Our 2,510th death is a 70-year-old male from Berkeley County. And our 2,511th death is a 56-year-old female from Kanawha County. Like I said, I appreciate your prayers. And I hate like crazy mistakes that are made and loved ones not respected like we should have respected them. And I do not understand the mistakes, nor do I think they're acceptable. But it was an honor reading those people, and I ask that you'll please, please, please keep all of them in your prayers. Please reach out to these families and let them know just how much you love them. You know, today's another anniversary. It marks the 1-year anniversary where I closed the schools, I closed the state basketball tournament, restricted visitation to our nursing homes. Today also marks the 1-year anniversary since we mobilized the West Virginia National Guard to respond to this COVID-19 pandemic. You know, I could never be more grateful to all the people that have stepped up and shown their leadership and their bravery, their courage, their dedication to their jobs and everything. All the great work the Guard and all of our health communities done in every way, first responders right on down. It is amazing, really and truly, what's happened in this great state, and to protect us like you have is amazing. These numbers pale in the numbers compared to what we just read. But in the last 24 hours in West Virginia, you have a daily positivity rate of 2.79. It's absolutely terrific. Your number of positive cases has dropped and dropped and dropped, and is now 346 in the last 24 hours. Your cumulative positive continues to fall. It's at 5.34. Your active cases are 5,280. You know, that is unbelievably down. 55 straight days it continues to go down. Your recovered cases are 127,051. The number of hospitalized are 159. There's 59 in the ICU units, and you have no red counties. If you just pause just a second and look at that map and everything, it is unbelievable. We're getting greener and greener and greener every day, and that is great, and we want to keep that red away, and we're doing that so far. A reminder always, if you're 65 years and older, I continue to remind and ask if you'll just please go get a test if you feel the least bit funny. Go get a test and everything. And if you happen to be positive, we can get you these antibodies that'll save your life. On last Friday, we lessened restrictions, on our restaurants and our bars and small businesses and retail stores and gyms and fitness centers and more. We also increased the gathering number to 100. We got to maintain the social distancing and all the stuff that goes with it. But really and truly, we lifted the capacity restrictions on all these places, and so we're continuing to awaken back to full speed and to as much normalcy as we can possibly have. All the guidelines are up right there, and I continue to encourage everyone to wear your mask and wear your mask, for a little bit longer. It's, I don't like it any more than you do, but if you'll just continue to do that, we'll all get across this finish line together. In our vaccine distribution update, we're at 92% total administration right now for our first and second doses, and we want to always get to 100%. And so that's why we continue to open up just a little bit more and a little bit more. from the standpoint of broadening who's eligible to be getting these shots. To date, in the state of West Virginia, we have now given out 603,783 doses. I mean, that's an amazing amount and everything, and we continue to lead the nation in lots and lots of different categories. 13% of our our population now is fully vaccinated with both the shots. We have dropped to 12th in the world. We want to try to climb back up there if we can, but that's still phenomenal beyond belief. Your pre-registration and everything is still available to you. We've dropped the age, to 50. The counties that are still lagging behind, they pointed those out, that we had as little as maybe 100 in some counties that were pre-registered. We surely need them to step up, and these counties are Gilmer, Calhoun, Clay, Wirt, Doddridge, Webster, Pocahontas, Grant, Pendleton, Braxton, Wyoming, Pleasance, Tyler, Tucker, and McDowell counties. We need y'all to step up, and step up now. We've got 373,000 that have been pre-registered, but we need more. Our wisdom clinics continue to operate in all 55 counties. You got to watch the weather alerts and all that. But we have now put in arms on people that I keep going back. This is probably the most impacting number for me at this point in time, with the exception of just having to read through and do what I just did for a bunch of people that we lost in West Virginia, but at the same time, we didn't get reported, and I think that's just unacceptable. But there was a time not long ago, I've told you this many, many times, when our elderly were wondering, when in the world am I ever going to be able to get a shot? Now that time has passed, has it not? And a lot of other states are all jumping in, and our president's jumping in and all that. But just think, if we could go back to really going as far as getting vaccines in their arms. We have now given shots to people in excess of 65 years or 65 years of age and older, 207,169 individuals. And 126,300 of them have gotten their second shots. Can you imagine? Can you just imagine, with all the names that I'm reading or all the ages and everything, can you imagine if we hadn't moved, how many of those people we'd lost? How many of those people would absolutely have been gone now? So it's good stuff. The COVID vaccine info line is up there. There's vaccine reminders all over the place and everything. Keep wearing your mask for a little bit longer. Absolutely, you can't grow antlers from getting this vaccine. It's incredibly safe and incredibly effective. You got to take advantage of our free testing. Our free testing maps are up there. We continue to thank Walgreens and Frith for all that they've done every day. Get this number. We have 3 long-term care facility outbreaks now in the entire state. It's amazing. That number was well over 100. We have 3. We also have 3 in our churches, and we want to watch now. We can't let our churches get wild here on us. We absolutely have to watch there. Those counties are Monongahela, Raleigh, and Nicholas County. And we got to really watch in that community. That community has done phenomenally well. Keep that pew in between you and wear that mask or just a little bit longer. Maintain that social distancing, wash your hands, and do all those things. And if you happen to be age 65 and above, and you can just hold on, and you can get your church services online or whatever, you may really want to look at doing that for just a little bit longer. Corrections, the number is dropping substantially and everything, but we're now back to 137 inmates and 15 staff that, as far as that we have at this time. The inmate cases are down nearly by 100 from Wednesday. There's 136 cases at our Western jail, and they had more than 200 on Wednesday, and we just have 1 case left at Southern. Okay, our face covering requirements, I've told you all about that. I ask you over and over each and every time that I come in front of you to give blood, especially if you've recovered from this dreaded disease and God above has blessed you beyond belief. Give blood. Give blood. You'll save a life. Yesterday we unveiled in the state of West Virginia. I'm really proud of it. I commend Secretary Chelsea Ruby for all the great work she's done and all of her team, but we unveiled the new West Virginia Vacation Guide, a travel inspiration magazine dedicated to promoting Almost Heaven, West Virginia. This guide will be used over the next year to attract more and more people to visit West Virginia and see all that we have to offer. And as we continue to vaccinate our people, and as our country continues to open back up and people feel safe to travel, where do we want them to come? We want them to come to West Virginia. And this year's guide is a special edition celebrating the 50th anniversary of the release of John Denver's song, Take Me Home, Country Roads. You know, what an incredible, incredible feat. And all you have to do to get your free copy of the tourism, you can request a free copy on the tourism website on the screen. So put that back up, Jordan, and people can go online, and that's it. You know, it's beautiful beyond belief. And go online and look at that country road taking somebody home, and where they want to come to is West Virginia. Just an announcement. Remember, on Sunday, we're going back to daylight savings time. Praise the Lord. Praise the Lord that we're going to go back to daylight savings time. And you will need to spring forward by setting your clocks ahead 1 hour on Saturday night. So move your clocks up an hour, enjoy the evening daylight, and hopefully we're on our way to a brighter, sunshiny day in West Virginia. That's all I've got right now.
All right, thank you, Governor. Let's now go to Dr. Ayn Amjad, our State Health Officer.
Good morning. As previously noted, there were 168 deaths that were reported by the DHHR on Wednesday. Our EPI team has done a thoroughly vetted process, and we now have 165 deaths to report. Through our quality assurance process, we found a duplicate first and last name that were on a death certificate. So that death that was listed at Berkeley Medical Center was removed. So Berkeley Medical Center had no deaths to report to our death reporting center as far as COVID-19. Wayne Nursing and Rehabilitation Center also had 2 deaths, but through our quality assurance process that the EPI team was working on over the last 2 days was removed. So those 3 deaths is what brought us down to the 165 deaths that the governor did report out just a few minutes ago. Because of the lag time in receiving death certificates, which takes up to 6 weeks sometimes, this is why the time is taking us some time to go through this. We do want to reassure everyone that this is taking place over the last few days, and it is a manual process that our EPI team is taking with each of the facilities that was listed about 2 days ago. We are also decreasing our biweekly process to a weekly process. It is a manual process that does take time, but we do want to reassure everyone that we are going to take the time to go through the death certificates with the facilities that was listed to make sure that these are done and fully vetted properly. We do understand that we had a lot of phone calls from all the facilities and there was a lot of concern out there, but we also want to make sure that we're very transparent with the public to make sure that we have these names of the death certificates and that we're properly reporting the information to the public accurately. Information to the public and being transparent is what we strive to be. And we also want to make sure we get this out there as quickly as possible. At the same time, our EPI team needs the time to go through this information in a proper way. And it's a manual process. So they go through the death certificates, they call each facility, they go through the records if they need to, and they are able to vet this. But that's how we came up with the 165 names that the governor was going through. But if there's any further questions, we're happy to take those. Our team did go through numerous emails, phone calls, and with all the facilities. But that's all I have. If there's any questions, we're happy to take those throughout the day. Thank you, Jordan.
Thank you, Dr. Amjad. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I'll be brief. The governor has gone through the list of West Virginians who have passed from COVID, and really my comments today are one of both respect for these West Virginians who have died, but also just to reinforce the idea that we are not done with this pandemic yet. Certainly, we are very, very proud of the great work of so many people, leaders at the governor's office, the leaders of the pandemic, all the great people that are working on this, from National Guard, DHHR, local health departments, and so numerous, hard to account individually. But we know that we had over 60,000 cases of COVID-19 diagnosed in the United States yesterday. We know that we have seen 8 deaths on 2 days, if I track the governor's comments correctly, and that's more than we had last week. So we know that COVID-19 is still with us. I think the governor's been very wise to not only target and focus our disciplined efforts on identifying and vaccinating our most vulnerable people. And as we see more vaccine, we will continue to make sure that we include more priority areas, that we create eligibility for people who need the vaccination. President Biden is committed that by May 1st, we will be able to open up the vaccination to all Americans. And certainly we hope to be able to do that perhaps even faster in West Virginia. But we want to maintain our commitment to discipline and to make sure that we are immunizing the people most likely to be hospitalized or to die first. And so West Virginia, it's really important you continue to wear masks, you continue to physically distance, and not let your guard down. Because while it's great and wonderful that we are able to open up more of West Virginia, including our great tourist industry, it is also really important to recognize that we still have been rated by Kaiser Family Foundation as the most vulnerable state related to the health of our population. And while we've done great, we want to make sure that we are finishing and across the finish line, continuing to do great. So thank you, West Virginia, for all you've done. But don't let your guard down now.
And Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
Well, good morning, Governor, and certainly all of you that have devoted so much time to this multiple times a week, simply for the transparency that the Governor and each of you are insisting on. Chatted with a number of individuals from Berkeley County that I know as personal friends. Even my wife got her shot this week, and they report that they were in and out in 30 minutes. 30 minutes and their life has changed. Just an amazing thing. Question: as we look at the state and we see there's 6 counties that are gold, 6 counties that are orange. As you move forward with this, will you be targeting or prioritizing those counties first for the next rounds of vaccine? And as we continue to move forward and people are starting to come out, socialize more and things like that, do you anticipate that maybe counties that are currently green may occasionally flicker up into the yellow or gold as you continue this good fight?
Well, first of all, Clay, Dr. Marsh and or General Hoyer, you guys take that question and everything. You can answer it far better than I. But Mark, thank you for your kind comments and everything. And I'm really glad things continue to move well up in Berkeley County. That's good.
Clay, I'll cover the first part. And so, Mark, you're right. We will continue to focus on counties primarily based on the age population piece, and we continue to monitor that and push more vaccines to get to that. Today, as the governor pointed out with the numbers he gave us, we're actually at 55% of our population over age 65. And we know we've got to continue to focus that and on the over age 50 population. So you will see that continue. You'll also see us, as the governor pointed out earlier, continue to develop more parallel paths to deliver the vaccine to include working with primary care healthcare providers, our federally qualified health clinics, our hospitals, and others going forward to make more paths available to get vaccines out. Clay, I'll turn it to you.
Thank you, Governor. Thank you, Jim. And Mark, thank you for your question. We do predict and anticipate that we will not see absolutely smooth sailing through each county. So we do anticipate there to be some variation in the transmission rates in counties as we continue to go forward. And so some counties may kind of, as you say, have moments of going from green to yellow or gold. Overall, we are optimistic that with the vaccines and the disciplined approach that we've done, that West Virginia will continue to shine on the national stage. But it's really important that we all understand that the reason why we do what we do that's resulted in us shining on the national stage is because we do believe very deeply in our hearts that every vaccine that is given to somebody may save a life. And so our commitment is to get as many vaccines to as many people as possible, start with the most vulnerable, and continue to evolve our priority list. So in a disciplined way, we get to every West Virginian. And I think that during that time, again, so important that even though we're opening up and things are looking much, much better, and we're so thankful, grateful for that, that West Virginia has got to be really careful, and our citizens not to drop your guard right now. We're at the last leg of the race, but we haven't finished the race yet. Thank you.
All right, thank you, Mark. Next is Steve Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers here. Obviously, President Biden made a number of statements and comments last night in regards to the progress on the COVID-19 pandemic and their goals between now and May, and ultimately July 4th, setting a goal of small groups being able to get together for then. So obviously a lot of claims made last night. I know that you were paying attention to what was said. I wanted to get your reactions to the goals that the Biden administration has set up for this. And I know obviously we've been a leader, so I presume, and I'm sure you'll say it, we're prepared to meet those goals as well. Thank you.
Well, Stephen, thanks a bunch. Thanks a bunch for all you do all the time. I've got just 2 or 3 comments. First of all, I'm tickled to death, of the progress that we're making, from on a national scale, and absolutely elated how we're doing in West Virginia. We've been through that bunches of times. We will absolutely step up. We're ready to go. We're ready to go to whatever volume, that can be provided to us in supply, and we'll get it done on our end. We've shown that we can do that over and over and over. And the only thing that really, we were doing a town hall, and then by the time we got through with the town hall and everything, I didn't catch much of it other than just seeing clips on the news later on, that evening, or last night. But I would say just this. The one thing that is lacking, we want to all be supportive and respectful of our president that we have now, our President Biden. But the thing that is absolutely lacking in his tone and his speech that I do not like, and it will come back to haunt, that's all there is to it, is his lack of appreciation for what President Trump did in many, many, many ways. At a time when there's no playbook, and at a time when somebody had to act, and really he did. And absolutely he very, very, in a way beyond belief, beyond all belief, he took us to a situation to where we have a vaccine today, and we had it in months, when it could have taken years. We were on a pathway 6 or 8 weeks ago where we were losing so many people at an accelerated rate beyond belief across this country. And just what if? What if we had no vaccine? Really and truly, what if? What if that acceleration had multiplied to even more at this point in time? What if we were on a rate of losing millions and millions of West Virginia, of Americans all across this land? Absolutely. We should always be appreciative, should we not? That's what West Virginians are. They're always, first and foremost, appreciative to others. You know, that tone that President Biden had last night, I cannot condone that, and I will not. Absolutely, I want to be supportive always of our president. From the standpoint of stimulus, I've said it over and over and over. I really think we have proven to ourselves how we have undersized. But really, when it really boils right down to it, did not this stimulus package get out of control too? We absolutely need to go big rather than small at this point in time. We've got to take care of people that are still out there by no fault of their own that are really hurting, where they can't pay their rent or they can't pay their power bill or whatever it may be. And businesses that are all to pieces all across this land that still are trying to recover, and they've mortgaged everything they have in order to try to some way maintain the storm and get through it. Now, we need to help those, do we not? But we did not need to come in and bail out pension funds and have all kinds of pet projects and all kinds of things all across this bill and spend money frivolously. Now, so I'm glad that we went big rather than go small. I'm not happy that we threw money away. And more importantly than anything, I think we should always appreciate others. So from that standpoint, there was surely, you know, and I had one more thing. Don't anyone forget that President Trump was supportive of a $1.8 trillion stimulus package and came out in favor that that's what he wanted to get passed, and Nancy Pelosi would not move. She wanted significantly more dollars than that, and she would not move. And this was prior to the election, and the reason that they wouldn't move is just plain politics. Playing politics with everybody's life. I'm not a fan of that either. So that's my 2 cents, Stephen. I appreciate you every day. Thank you, buddy.
All right, thank you, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking a moment for the question. Governor, I want to give credit where credit's due. West Virginia's vaccine distribution efforts led by you and, of course, General Hoyer have gone very, very well and should be congratulated. And I also think we should celebrate vaccinating more than 200,000 of our 65 plus citizens. That's a tremendous achievement. But let's not forget, and let's make sure that we remember that West Virginia has about 350,000 65 and older senior citizens. That means that according to our data, about 143,000 of these senior citizens have not yet received their first shot. So while it's great to celebrate the accomplishments, don't we need to keep our eye on the ball to make sure that that population is treated as well as the previous elders who got the shot, and also recognize that it just gets harder and harder to vaccinate everyone as the numbers get smaller.
Let me comment on the last thing you said. Harder and harder as the numbers get smaller. You're dead right. You're dead exactly on the money right. Now, but that means that we just got to step up more, does it not? The challenge may get bigger, but we absolutely step up more. Now, from the standpoint of those, I mean, you hear me every day that are over 65, pleading with them on 2 accounts. Get registered, please get pre-registered. Please sign up to where we can get you in the system and get you the shot. Please sign up. And also, you hear me every day say to them, you're not going to grow antlers from this. You're not going to have all that kind of stuff happen. Just sign up. Just sign up to where we can get you in the system and we can get you this shot. And please quit listening to this taboos out there about not taking the vaccine. You still got a percentage of people out there that truly, no matter what we say, some of them are not going to take the vaccine. We had, let me see, they've sent me a little note here. It says, we know we had some in our nursing homes that chose not to take the shot at first. And once they saw that it was all okay and clear sailing, then they signed up later on. We saw a situation in a nursing home where everybody had been vaccinated and nobody was getting COVID and everything. And there's 8 staff members that weren't, and all 8 out of 8 of them got it. So we see all kinds of evidence all around us that where people should sign up and they should take the vaccine. And one thing I want to check with General Hoyer, if General you could step in, is this number of 200 and whatever thousand, that have gotten their first doses of 65 and older. Is that totally inclusive of all the 65 and olders all across our state that is in that number of 350,000?
Yes, sir, Governor. And we're running right now at 55% of our population over 65, and we will continue, Kenny, to put parallel paths out to get people in that age group vaccinated. The governor's pressed us now to look at other ways to focus on getting over 65 to take the vaccine.
All right. Well, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Amjad. Could you tell us a little bit more about these dialogues that you're having with these facilities? What are the officials from these facilities telling you? Is there any sort of, rationale or reasoning that they're coming up with as to why this happened? Thank you.
Charles, most of the conversations are with our epidemiology team and the facilities. So most of the conversations are double checking the death certificates and the reporting requirements. So the conversations that they're having are double checking the death certificates to medical records. And if they did report them to whether it's the health departments or whether forms were filled in. And a lot of it is with education as well of reporting requirements. So those are still ongoing, and we want to make sure those are vetted accurately so that everyone wants to do the right thing. Everyone wants to make sure they're reporting accurately because this is important to not only the state as well as the facilities. So these conversations are still ongoing, but a lot of it is basically, if the certificates were, cross-checked with the patients, and then also if the reporting requirements are done accurately. So these conversations are still ongoing to make sure that they're accurate, but everyone does want to report accurately, but they're having them with our epidemiology team, and there's a lot of people involved with that.
All right. Thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Yesterday, I went to get a haircut at the beauty shop, and they let me go eventually. But the big question there were a number of ladies there that have autoimmune disease or an autoimmune disorder, and they were concerned about getting the vaccine. And I said, okay, I'll throw it to Dr. Marsh or Dr. Amjad and get a good answer for you. So there you go.
Okay, Doc.
Well, I'll start, Ian, if that's okay. Thank you, Paul, for the question. We do believe these vaccines are not only safe for people who have immune-based diseases, but are very important to be considered. The autoimmune diseases that generally people identify are ones that often require medicines to reduce the activity of the immune system. And therefore people are oftentimes at risk for certain infections and can have more severe complications of those infections. And therefore we are very much recommending that these people be vaccinated. It's possible that if people are on medicines that suppress the immune system, that their response to the vaccine may not be quite as robust or as effective as others. At the same time, though, that we still know that these vaccines give people protection. The one immune, autoimmune or immune related disorder that people should talk to their doctors about, though, and of course, if you have any questions, everybody should discuss with their doctors, their healthcare workers who have complicated medical problems before they make any moves, which is always a good idea, but are people that have inflammatory problems of their brain or their spinal cord or some of the nerves in their legs. A disease called Guillain-Barré syndrome. There's several others, and because of the impact of the immune response against part of the nervous system, that's something that you definitely want to talk to your healthcare worker before you take a vaccine, although generally most people will still be able to take the vaccines and do okay. I don't know if you have anything else to add.
No, thanks, Claude.
All right, thank you, Paul. Next, we'll go to Haley Kosick with Nexstar Media.
All right. Good afternoon, everyone. For my question, yesterday I was up in Nicholas County and I spoke with two gentlemen who were above the age of 65, and both of them had not even received their first dose of the vaccine, which is, the many cases for those in the Mountain State. With that being said, a lot of them said, for those two individuals, that they didn't know how to register to begin with. They didn't have internet access, and they just didn't even really know how to sign up for the vaccine. So in situations like that, what should those individuals do? Because it seems like there's just a disconnect there to even sign up and get up on that wait list for the vaccine.
Haley, is that correct? Haley, this is the governor. Haley, some way, somehow, we've got to get the word out maybe better, but we keep telling people over and over and over, and it's just this, is if you don't know how to get on the internet, you've got to, I'm terrible on tech savvy stuff, but listen, all you got to do is call us. Just call somebody. Call down here, call one of the hotlines that's up like crazy. Just call somebody and tell them that you're 65 plus and everything, and you don't know how to get, registered and everything, and we'll get it done. We'll get it done in 10 minutes. But please just call us, and some way, somehow, we've got to get that word out better, and we'll work on a way to keep pushing that as well. But Haley, you can help us. You can help us. All the news media that's on can help us. All we got to do is just inform people that are 65 years of age and older. Please, just absolutely call us if you're having trouble getting online and getting registered and everything. That's a crying shame if we've got a lot of people out there that are, that just can't get that, figure out how to do that, but need their shots.
All right, thank you, Haley. Governor, I'll turn it back to you.
Well, I'm really, really happy about Haley's question because, let's be fair again and just think, a lot of people that are 65 or 75 years of age, all this tech age that we're in right now just came about long. They were here long before the tech age came about. And so a lot of people just don't know how to do it. Now, we've been telling them over and over, and I thought, that we were really making inroads as far as telling them to just call us. But some way, Haley, if you could get those words out and everything, it'd be really beneficial to all of us, and it would really, really help those and everything. But all the media, if you could take this as a lead and really, really help step up with that, what we need to do is have a real campaign to where everyone knows some methodology to just call us, and absolutely we'll get them registered and we'll get their shot. The only other thing I'd add today has been a tough one. When you read through all those names and the whole time that I'm reading, I'm thinking about stuff like Can you imagine all the people, all that they gave to so many? All the people that are mourning their loss of their death and everything. Can you imagine? Can you just imagine what 165 or plus 16 that we read through today? 181 people gave to our state, gave to all their loved ones, gave to a contribution of work. Can you imagine? And so, sure, it's tough reading the names, but it's nothing compared to the honor that we should give to all those people all the time. Keep them in your prayers, West Virginia. Keep going. You're doing good. Just hang tough for just a little longer. Thank y'all now.